Hi, good morning. This is Andrew Lau from LowSutea president. Hey, I'm so happy that we can able to chat with you again today because this is ongoing webinar that we will talk about first. We have been talking about cholesterol, and then now our next subject now is get down to, hey, what is relations of weight and versus your pre-diabetic or three high. Now, I was surprised. Actually, a lot of people wrote back to me and say, "Hey, Andrew, that's really good. I now understand a little more about the importance of lower my cholesterol." But a lot of people said I have difficulty really lower my weight because many of them is already at age 50, 60, and 65, and the weight was there for a while. And they said, how I'm going to do it? Because somehow I just could not get my weight down. Plus, when I start, continue to do whatever same lifestyle, my weight not going down, but continue going upward. So they have really big concern. Plus, the three high because of the weight, they are continue also going up. So net result, I thought that, okay, we need to provide you some tips how to control your weight and how to lose your weight. So hopefully with that, you will get some idea. Now you know the importance to lower your cholesterol. You need to know about lower your three high, your blood sugar, and cholesterol, eventually your blood pressure. Now, how do you do it? One of the important thing is weight. If you can able to control your weight, the successful will be really good. So let's start our webinar today. Okay, so today what we'll talk about is how you control your weight. Now, why weight is so important? Seriously, it is important. If you can actually control your weight, for example, lower your weight for 10%. So what that means is if your weight is now is 220 pounds, and then I lower 10%, which is mean that my weight will come down to basically 200 pounds. So that's basically 10%. But what is the benefit with that? If you are a pre-diabetic diabetes, you most likely you will lower your 1 point of A1C. In other words, your A1C is way back in 8, you drop down to 7, 7 go down to 6. So importantly with that, you will definitely able to lower your blood sugar, and your cholesterol probably improve also. If you continue the same lifestyle, understand how to lower your weight, you're much healthier because you were able to have to lower weight. One of the things that you have to exercise. So all that including together, you will become a better person. And I think this is something that today's webinar will be very beneficial for you to listen and continue to start working on it. You will be really to be a better person at the end of the day. So let's talk about that today with weight loss tips for the pre-diabetic. So we'll talk about first what is the weight issue. We understand what pre-diabetic, diabetic, how the impact weight on your blood sugar level, and what is the smart tip to really lower your weight loss, and then how to motivate that continuum. Now, why motivation is important and how to track it? Because a lot of people start lowering their weight. They only basically did it like 1 or 2 months. Now, certainly they will get that going and they see the weight going down. And then they say, okay, now I can stop. And many of them stop in just 1 or 2 months and no longer keep up the continuing of the things that they used to do to lose the weight. So net result of that, sadly, the eventual weight will continue to go up. And that's what a lot of the client that I have right now telling me, hey, somehow I can't do it to lower my weight. So no problem. Today with this webinar, you will hear the kind of things we'll do. And I'm pretty sure after you listen, hear it, you will say, wow, okay, I know what I have to do now. So that is going to be. Now, today I noticed a lot of people, I don't know the name. They may be from all different places, from Hong Kong. They are maybe from the United States, from Canada. I'm not familiar with them yet. So I want to catch them up with them. How 4 stage you will get from 3 high all the way down to pre-diabetic diabetes. So it goes through 4 stages, and majority of people all go through that. The first stage is your LDL, the bad cholesterol going up. When the LDL cholesterol going up, it damages the B cell, which is the cells come up from the pancreas, which will take sugar to the cells. However, If the B cell damage, more B cell count doesn't work, your blood sugar will continue to go up in the bloodstream. So the cholesterol and the blood sugar mix together, the problem will start. The blood becomes thick. And then become thick is from plaques everywhere. So you see all these plaques is formed. Once the plaque forms, the blood pressure goes up. So that's the second stage now. Now, this is actually eventually will be the worst of really diabetic, because diabetic, that's the problem. They plaques everywhere because your blood sugar and the cholesterol mix together. It plaques everywhere. Go to your brain, your heart, your kidney, everywhere. So it start damaging all the vessels. So that's really starting your stage of getting destruction on your body. Now, very quickly, you don't do anything because you have no sign and symptoms. You have no motivation to continue to do anything yet. You move to so-called type, your stage 3, which is your pre-diabetic stage. Now, the pre-diabetic stage, every doctor will have to measure the same thing, which is measure your hemoglobin percentage of sugar attached to this hemoglobin. Hemoglobin is the red blood cells. And if you have 5.7% of sugar attached, you're a normal person. Anything below is still normal person. Anything above 5.7 to 6.4, you are now in pre-diabetic stage. Now, sadly, in pre-diabetic stages, already say, hey, you're pre-diabetic. You're setting yourself to be a diabetic. You have no medication. Only thing you can do is start changing your lifestyle, which is your diet, your exercise, your weight. Today, we talk about weight. And then really need to track and change that company lifestyle. Now, certainly, you can, one choice you can also add on is LowSutea. If you drink LowSutea, it will help you definitely lower your blood sugar, cholesterol, and blood pressure. Net result, you will be healthy, and then if you continue the lifestyle, will never convert to diabetes. Isn't that great? So that's what you need to do. Now, if you don't do anything, 2 to 3 years, you become a diabetic. And once you become diabetic, you ever be diabetic, you cannot convert back. And that is the 4 stages. So that's why you need to understand why it's so important not to get into the pre-diabetic and diabetic stage. If you already have the 3 high, control there, never get down to pre-diabetic stage, that would be the best strategy. Now, why LowSutea? LowSutea basically is a natural 100% no caffeine drink. Inside there are 2 things in there. One is called guava leaves, the other called bitter melon. The guava leaves will delay absorption of sugar into the bloodstream. Bitter melon is, what it does is increase the sensitivity of the insulin, so it take back the sugar to the cells, so it can use as a fuel. Now then, it also excess sugar and cholesterol and salt will dump after the urine. And after dumping urine, your 3 high will lower because your cholesterol lower, your sugar is lower, your blood pressure lower because the salt went down. Plus, it comes with detox. So LowSutea is a tremendous super drink, very simple, very delicious, help you to continue to drink to lower that 3 high so you never get to pre-diabetic or diabetic stage. Now, we don't want to just give you drinking LowSutea because you got to change your lifestyle. If you change your lifestyle, you're healthy forever. You continue live long time with very little sickness. What does that mean? That means you have to drink 6 to 8 glasses of LowSutea per day. You have to continue a low carb diet, low fat diet. You have to exercise 8 to 10,000 steps per day. You have to control your weight. Your BMI has to go from 30 all the way down 23, whatever you're high. That you have to have a target 23 and below. And then you have to listen to a webinar to basically understand what is the disease process, understand why I have to do this to maintain my good health so I don't get very sick down the road. Plus, how to track your blood, your food, and so forth. All that we've done. Now, I have a lot of patients, a lot of clients. The A1C is 10 plus. Some even go as far as 15 and higher. That we brought it back down to about 6 or below 6. Many of them, I saw it with my own eye, was get to 5.7. However, they really need to work on it. It's not like free. They have to go on really good lifestyle change, the diet change, the exercise change, the weight change, and drinking LowSutea. Somehow it's kind of strange. If you don't drink LowSutea, somehow the A1C doesn't drop. It will just continue to go up, even with medication. So LowSutea has kind of like a very magic, support this lifestyle change. So let's keep doing it, because that will be really improve your health condition. So let's understand what is a pre-diabetic diabetes we'll talk about. Now, as you know, pre-diabetic is the blood sugar is high, but you're not quite there called diabetes. Your A1C is between 5.7 to 6.4. This is the range we're at. If you have diabetes, you're type 2 diabetic, you will be 6.4 and above. Now, as you know, diabetic is a chronic disease. You don't get well. You basically can only control. So basically, if you get to pre-diabetic, you gotta really control yourself not to go to diabetes. Once you get diabetes, you know where you got A1C over 6.5, you're ever diabetic. You're no way you can go back. Okay, so really, what you're trying to do is get yourself below 6.4, and always, hopefully, we'll all close to 5.7, and that's a major difference. Now, however, in the United States, you know, that's 96 million people are pre-diabetic, and many of them don't even know. So 1 in 3 people are pre-diabetic, and Americans don't even know they have. Many of them, 80% don't know, and they usually got it as, I'm pre-diabetic. So they all caught in surprise. Now 30% also adolescent now also meeting this criteria because of the diet change, the weight, and so forth. They are very young now. So it used to be when I was an ICU nurse before, all these are more older age, which is like people who are 60 and above. But now I see people as 30, they become a diabetes, which is really sad, because really is a diet change. They don't exercise. They tend to eat all kind of very sweet things and continue to increase their blood sugar. You know, that is the issue. Now, so in health, World Health Organization right now is about 430 million people are already globally are type 2 diabetic, and all these are type 2 diabetic. And they, the cost of death is about 1.5 million people, and they and a lot of people also have kidney disease, and they'll die of kidney disease. And many of them have blindness, stroke, heart disease, amputation, kidney disease. Matter of fact, I just had a client who came in earlier. They are actually an elderly person, 60-something years old, very nice lady. But unfortunately, because of diabetic, she now needs to do dialysis. Wow, her lifestyle totally changed. And basically, lucky she now on CAPD, and plus drinking LTs. But on the other hand, that make her, she really have difficulty with her daily life, change everything. Her kidney is not functioning anymore as she want to, but at least she's on CAPD, so she can still maintain some little bit of her kidney function. So really, at the end of the day, you don't want to get into this stage, because that will be very, very hard in your lifestyle and your whole life ongoing. Plus, if you have diabetes, you have high chances of cardiovascular disease, and you might end up dying because of cardiovascular disease. So you really do not want to get yourself into diabetes stage, okay? Try really hard. Change your lifestyle when you're pre-diabetic, not to get into there, and you'll be continuing healthy. Now, however, hey, what happened? You are still now got into type 2 diabetes. Well, what signs and symptoms to look at? Now, majority of people might not have no sign and symptom because of the fact that, diabetes early sign, they really have no sort of symptom to tell you that, you're pre-diabetic. As a matter of fact, I just have a client comes in, and his blood sugar is 16, okay? It's very high. But after 3 weeks of drinking LowSutea, brought it back to 5, but doctors still think that he is pre-diabetic now. But the thing is, he has no symptom. Only thing he has, one thing is he lost weight, okay, which is frequent. A lot of people have lost weight. But some of the other symptom of type 2 diabetes, increased thirst. We have very dry skin. A lot of pre-diabetic patients also told me, hey, my skin is very dry, very itchy, and really start skin become flaky. That lower extremity I'm talking about, that is a very good sign of being pre-diabetic. And then you might have blurred vision, you might get fatigue, you have tingling feeling of feet, and then you might end up with a lot of yeast infection, itchy infection. You can be very hungry suddenly, even eat a lot, somehow never satisfied, you have numbness. And also one more thing is frequent urination. And sometimes you see a sore, which is like a blister or a cut, doesn't heal well. It's just very slow. Now, these are really true early warning sign of the diabetes, type 2 diabetic. So if you have that, you really got to go to see doctor and see what the doctor need to do with you and how you continue to monitor. And if you are not able to do anything, you just continue to do the same lifestyle, that will be bad because really the sugar will not come down by itself, will just continue to goes up. And I have another client that's very interesting. Her blood sugar went all the way to 20 something, which is very high. Ended up she actually go to the hospital. And she called me in the hospital and said, hey, Andrew, my blood sugar. I said, wow, you got to really, and they give her insulin to bring it down first. Then eventually back to oral medication and insulin both. But now she's drinking LowSutea, and so her blood sugar is getting down to 7 now. So it's good, right? But with that though, she really had no idea her blood sugar was that bad. Had no idea until suddenly feel really not well, very fatigued and things like that. So this is something that suddenly they start, wow, I'm that bad. So imagine if that's the case, you better start understanding how your body changed and you gotta fix it, okay? Because don't fix it, few years later, you're gonna have all these problems. Like especially elderly, you're gonna have problem with stroke, you got lost consciousness, lost memory. I don't know you have any auntie or elderly, keep asking the same question over again in the last 5 minutes. They lost a short-term memory. That probably due to diabetes they have. And that I experienced quite a few patients with that. And it's very irritating to the family. You say, Mom, you just asked me 10 times, you asked me the same thing. But sadly, the mom don't know because of the fact that this is the blood going through here, but it's blocked up by the sugar at the end. So the brain cannot work anymore. So they don't remember. I just asked you the questions. So these are the things that you will probably see a lot of your elderly mother, relatives, and so forth do the same thing because the sugar just blocks our brain and it doesn't give information. So you do not know, I've asked that question. So loss of memory has quite a bit of this elderly have that problem. And also you have cataract, glaucoma, and basically, if you see an eye doctor, you can see your eye with all the vessels blocking up, blatching up. It's terrible. And you might lose your vision and already have some young diabetes, 40-something years old engineers, start losing that vision. Imagine, you still have 20 more years to live, but you lose that vision, everything become blur. Man, that's terrible. You don't want to be in that boat. Plus, pancreas dysfunction. So you need to have insulin. You have to inject. If not, you will not able to function. The more important, you're going to have heart disease. Now, that is 70% of people might potential coronary artery disease, where heart disease, the sugar keep building plaques at the back. The blood cannot go through, and it stops your heart because it doesn't feed the heart muscles. And if your heart stops, you know what? You die. And that's the end of the story. And you don't want to be in that boat. Plus, you might have high blood pressure. Remember just now we said all the plaques all over the vessels. You have high blood pressure and your vessel become hardened. Now, a lot of people don't even realize you have nerve damage. What's that mean? Because the nerve is also blocked, so they cannot send signal anymore. So you have stomach issue, gut issue, all kind of issue. More worse issue is you can't feel. So many of the diabetic, 30% of that, they don't have sexual function because they don't feel. And on top of the lower extremity, they don't feel the pain, they lost the sensation, they feel numbness. And that result, when you're injured, you don't know to be infected, and you have to cut off your foot, it's called amputation. Man, that's sad, boy. So you don't want that in that boat either. And also there's a diabetic nephropathy, meaning the kidney got damaged, so you need to go dialysis. Like my new client who came in, nice lady, but she has to go dialysis every day. Imagine that. So net result, now if you're pregnant, you're also a good chance of they call pregnancy complication due to gestation diabetic. And net result, you just change to be diabetes. Now, you also have other risk factor, you become a pre-diabetic diabetes, there's several things. One, obesity. That's why I want to talk to you more about today, how you lower your weight. If you're obese, you have a big issue of really getting yourself to be a person that with a chance of high chances of a diabetic, because you're overweight and the blood sugar will continue to be high, so you really have an issue. Now, secondly, you also have high cholesterol, high blood pressure level. Remember, we said that the cholesterol mix it with a sugar in the blood. You end up, you have a lot of clotting in this blood vessel system. Your family history will be an issue. Like, for example, if your family history is, your brother, uncle, auntie have diabetes, you will definitely you will have a chance of diabetes because genetic change. If you're 45 years old and older, yes, you have the issue because elderly. And you are a person who is sedative, you really doesn't move, you only like to watch TV, most likely you'll be obese, and plus your blood pressure, your body is also overweight. That is another issue. Now, another one is called sleep apnea. Now, a lot of people don't realize, especially your sleep apnea. Here is you have this area is very, very right, with a lot of fat, and that result your tongue drop back and you really stop your breathing and brain cannot work. And that result, because of sleep apnea, the more chances you have type 2 diabetic, plus one more thing, you can potentially have stroke. So this is another risk factor for people who are pre-diabetic, will give you that same issue. Now, so really at the end of the day, what is the weight, body weight? If I'm obese, why will actually create problem for me? Especially will not help me with my diabetes or pre-diabetic. Now, first of all, if you are increased weight, your blood sugar level will always goes up because it's just part of the body process. One of the things that will come in already is your insulin resistance. So if you're insulin resistant, you're going to have a lot of excess fat and all go around the body, abdomen, you're big, chubby here. And then you make your body very difficult to regulate your body sugar. Okay, that is a problem first, because when you're overweight, insulin resistance is the key issue here. So that's the reason why when you go to a doctor examining, why the hell they keep measuring my tummy, the size of my tummy, because the bigger you have, they figure you probably have a more higher chance of insulin resistance. Secondly, inflammation. Inflammation is the real issue if you are obese, and then you base it, if you're obese, you tend to increase inflammation, which is, again, with the inflammation, that all kind of issues come in. But one of the more important is your insulin become really less efficiency, and it will less the insulin function. So that become a second problem you have. Now, the third one is called metabolic syndrome, meaning that you're overweight, you already weight is issue, your blood pressure will be issue, and your high blood sugar will be issue, and your cholesterol will be issue. All that will give you potential risk to go into that diabetes, and also pre-diabetic first and then to diabetes. So all these are all related to the weight, okay? So if I have a lot of excess weight, what do I do? In fact, because your end result, if you're overweight, you actually will increase the chances to be a pre-diabetic. You also increase chances of diabetes. I actually experienced that. I used to be 225 pounds, okay? So the doctors say, hey, you don't lower your weight, you continue the same lifestyle, you will be a diabetes, okay? And it's really enough. Actually, I will start marching myself with the A1C all the way to 6.9, which is in short term. But Lucky during the time, once I start realizing I got to start doing this thing. So I try to push my A1C all the way down below 6.4, which I was successful. Why? One thing, I lower my weight all the way to 225, all the way to 195. Really good. Secondly, I really control my blood sugar control, which is meaning I now really looking at like diet control. I don't eat a lot of, carb stuff. I lower my fat intake. So my body weight is definitely related to all the blood sugar issue, is now doing better and better. Now, certainly I never went to medication or insulin because of the fact that I was trying to control my blood sugar. But other people might need to have blood sugar and control blood sugar using medication like insulin, like or metformin, whatever you need to. But importantly is you now need to control the sugar. So and so also you have to control the weight, so your A1C will be able to drop. Now, if you do not drop this A1C, your weight continue to be high, you risk to have all kinds of complication, including stroke and heart attack, all that. Now, if you do not continue to manage your weight, and then what happened is even medication, insulin would not be as effective. So that is very important. So manage your weight, lower your weight, really able to help your pre-diabetic diabetes. So in other words, if you lower your weight like myself, I lower my weight from 220 all the way to 225, sorry, all the way down to 195. I dropped 1 point A1C. My A1C becomes 6 and below. Secondly, I no longer be a diabetes because I was just in very short term. I get myself down. My blood sugar level also every day counted is like 5.56, which is like 100 milligram per dil, that type of blood sugar. So I was in good shape in that sense. My sugar level is good. My body weight is good. Is really, if you lower your body weight, your lower sugar, you will definitely lower your whole chances of any kind of health complication. And that result, you have better blood pressure control, you have improved your cholesterol level, and you have increased more energy and more mobility. You reduce all the risk of complication like related to diabetes, like for a stroke, heart attack, kidney disease, or nerve damage. Now, very important, because at the end of the day, I do feel much better because now I'm not overweight, first of all. Secondly, my A1Cs always tend to be very nice, be 5.5. A1C, my A1C was 5.7. Sorry, my A1C was 5.7. And I see myself with a lot of people that I work with, the A1C dropped down to 6, 6.8, 6.4, 5, 6.6, 5.7, around the age. If you stay in that age, you'll be very good in a sense of health-wise because of the fact that now you no longer risk of really becoming a diabetes, right? So that is important. You need to do that. So weight loss definitely help you to better control A1C, control your cholesterol, use just because your weight change, okay? So the next question you might ask, hey, Andrew, you tell me all the good stuff is nice to know. My weight doesn't want to come down. I try, but nevertheless, it continue to go up. Well, then really need to know is what tips you need to have to really lower your weight, okay? Because you have to work on it. You have to do it all the time. The first thing is you have to adapt a healthy diet. In other words, you have to eat balanced, low sugar, low fat, and high fiber, like grain, fruits, a lot of vegetable, regulate your blood sugar, prevent you now go from a pre-diabetic, diabetic, or you have 3 high only, you won't go down to pre-diabetic stage. And you have to drink LowSutea every day, 2 glasses, pre and post a meal. So help you to start that off first. Now, another thing, you have to be half a plate is all vegetable, and 1/4 plate is your protein, fish, and whatever. One quarter plate is your starch, which is like instead of eating rice, white rice, you eat like brown rice or red rice. So net result, you have a lot of fiber, but very little starch, basically, okay? Now, very important, every time you buy things, you have to start reading the label. Make sure you know that the carbs are not very high, because if you're able to control your carbs, it will be 150 to 200 gram carb. That's what you have. So you got to measure yourself. So you look at the nutritional label, how much sugar you have. So my breakfast will be 7-10 grams of carbs. That's good. Okay, so you have to look at that. You look at that. You look at protein giving you. Now you have to choose food with low glycemic index value, like apple instead of mango. You want to eat fish. All these things is low blood sugar level stable food that which also slow down the sugar breakdown. It doesn't spike the sugar. Those are things called glycemic index, which you need to follow. Now you have a lot of fibers, food that has high fibers and protein, which again, because the high fiber, the sugar doesn't absorb that fast, it slowly digests. It will give you full, fast, feeling full and satisfied for a longer period of time, so you don't keep eating. If you eat more, guess what? Then your fat, your body get more weight, right? So fibers is a good stuff to help you. And what food to avoid though is like the sugar drink, bubble tea. Forget bubble tea, because my client, when they start, I see them so high blood sugar, is they drink a lot of bubble tea. Go to they love the sweet, right? So cut that off. And also the refined carbs like white bread, pasta, rice, these are not good because that will spike our blood sugar. Especially you have a white Chinese bun, man, that thing go boost up like a stock rocket for you. Fried food, like for example, French fry, those are very fat and a lot of calories and so forth. Like sweetened breakfast cereal, that's again, a lot of people don't realize we eat 50 pounds of sugar. If you buy those cereal box in the supermarket, you got to go for really low sugar unsweetened cereals. And also processed snack like chips, cookie, crackers, all those things has to be not given away. Now, flavored yogurt, again, high sugar yogurt, because it's high level of sugar. That's why it tastes real good. So maybe you could change it to Greek yogurts, right? And fatty meals like bacon, sausage, red meat, all these are contained of high saturated fat. If you can cut that off, that will be wonderful, because that will help you to lower your chances of heart attack also. Now, also, food don't have to totally limit, but you should eat less. You have to be mindful. So things like starchy vegetable, like potato, corn, peas, maybe that will cause you to get sugar spike. So don't eat a lot of that with that high carb thing. So the vegetable we have more is lettuce and so forth. Eat a lot of lettuce, okay? And then don't eat dry fruits, because dry fruit is a very, very also high concentrated sugar. If you eat fruits that is like, for example, fruits like apple, pears, instead of eating a mango, it's very high sugar. Want to get fruits with a lot more fiber type, so it can slowly digest in the system. Do not drink juice, because juice is the one that will give you tremendous blood sugar spike. Now, you have to continue to maintain a healthy diet habit, okay? So you can ask the doctor to work with you, or nutritional to work with you, to basically provide you some so-called menu for you to follow through. There's a lot of things in the web now you can follow through to help you to control your carbs, low carb diet. Now, very important, tip 2, you have to exercise. With the exercise, American Heart Association said every day you got to work 10,000 steps or 150 minutes per week of exercise. That really works. Now, exercise will help you to improve the blood sugar control, enhance the insulin sensitivity, also will help you to weight management. Now, that's what you want. If you don't exercise, the chances your weight will not maintain, will just keep up, okay? So I have been suggesting with all my clients that, hey, after dinner, walk with your friend, your husband, whoever, go to shopping mall, walk 10,000 steps. Majority of people who did that said they have very successful maintained or lower the weight, and also they feel good. They feel enjoyable because they went to the shopping mall, look at all the stuff they want to buy. And on top of it, it increases the muscle strength, endurance. Now, as you go older, if you don't walk, you know what? You cannot walk, as will be very bad for your real bad for your body, and your leg is not going to lose function. Now, the third tip is you have to manage your stress, because stress increases the cortisol and adrenaline, and it puts sugar out to your body. So you decrease the stress, you tend to have much more healthier, you cope your coping mechanism. Take some deep breath, and you don't smoke, you don't eat chips, because when you're stressed, you tend to have the hunger hormone coming out, you can start eating a lot of stuff. That is not going to help you to lower your not help you lower your weight, or just increase your weight. So stress tend to increase weight because you can't eating chips, cookies to lower that. Now, a lot of people don't realize when sleep, you have to have good sleep. Every person got to have 7-hour good sleep, because if you have good sleep, it helps you better regulate your blood sugar level, and it also don't get you to have weight gain, decrease your risk to become a type 2 or or pre-diabetic. You need to create a good environment for you to sleep, like cool, dark area, relax. Don't watch TV, not getting the blue light out because of the TV, or getting some of the items such as the TV that affect the sleep. So you have to continue to stay motivated, in a sense, for you. You have to have smart code to measure yourself. Hey, I have to walk 10,000 steps. How do I do that? So track it with your watch. Track it with your phone. Don't watch your phone. Everybody can do that. And you overcome the action that you do. You have to also celebrate, hey, I did 10,000 steps. Get yourself something, right? Get some gift, whatever. And always you have to be kind to yourself, tell your family support you, give you some kind of encouragement, give you a pat on the back. Hey, Dad, you're doing good. Now, you have to schedule exercise, meaning that I say, I will every day after dinner, I walk to shopping mall for 10,000 steps. So that's important, just keep it up. And then you track lifestyle change, meaning your diet, exercise, your weight. Every day you weight yourself, that you know that, hey, my weight is coming down. And then you adjust accordingly, because you really can't plan everything. It won't work. You have to do it and work along the way and plan as you go on. And weight loss, you have to continue track your weight every day, checking your weight. Your scale will look like you're 180 pounds today. How about tomorrow, 180 pounds or 170 pounds or 179, whatever. You will continue to see yourself going down. And certainly a phone is really good now, because phone has all kind of apps that help you. And then you have to also measure your blood sugar if you are pre-diabetic or diabetes. So you can use the continued glucose monitoring, like the Abbott Libby, to help you read and keep motivating you to continue to lower your blood sugar. So drink LowSutea really helps, because it does help you to lower your blood sugar, pressure, and cholesterol. And with that, if you lower your 3 high, you know what? You will be healthy forever. So in conclusion today, if you are pre-diabetic, you're going to most likely you have no sign symptom. However, if you become a diabetes, you have also might start out with no symptom. But you need to look for the warning signs, like tired, fatigue, dry skin, and then numbness of here and there. So those are things that you really have to look and watch. But the important thing, you have to see the doctor, see what is your A1C. A1C measure 3 months average, so you can see it. And on top of that, your excess body weight, like for example, if you're overweight by BMI already 30 and up. Now, if that's the case, you really need to lower it to 23, because your body weight is really high. You know what? You lead to insulin resistance. your cell doesn't respond well to insulin, so that result your blood sugar could go up and start blocking everywhere. And you have to balance your diet, like for example, including your nutritious diet with low fat, low sugar, low carb diet. You have to regular exercise, and that will be a whole life change or modification. You know what? That will help you to live longer, because if you have that, if you continue that lifestyle, you're not going to eat a lot of fats, you're not going to eat a lot of carbs, you're eating less sugar, and your weight will start going down. Most likely your 3 high will tremendously improve. You will not go into pre-diabetic. You will be not going to diabetes. You will be healthy, and you will continue that you live much longer. Now, all those you need to set goals to give up this sustainability, to give you not only a short-term fix, but there's got to be a long-term. This is meaning that you are starting at 50 years old, you have to using the same thing all the way to 70s, 80, 90 years old. And you have to practice a mindful eating, not to go stress yourself, relax, take deep breathing, and also make sure you get good sleep every day, 7 hours or more. And so also use some tracking tools to track yourself. Are you doing it? Or you are able to losing the weight and measure yourself every day. You start seeing that weight going down. If your weight go down from BMI 30 and all the way 23, I'm pretty sure you will improve your, because your weight, you will improve your 3 high. The chances you become a pre-diabetic is much less. Even you are diabetes, you move yourself to a pre-diabetic stage and continue to be healthy. So today, this is my webinar. I hope that you enjoyed it. I am able to get your idea of the tip. Really, you got to work on it. You don't work on it, you won't get it. And if you have a question, write to us. My address is andy@wafong.com, ANDY at WAHFONG.com. And my cell phone number, WhatsApp, is 852-6792-8891. 852-6792-8891 or 852-3001-5644. So do write to us, because a lot of people do, and I do got a lot of comment out of that. And on top of it, I will answer a question through email. That would be wonderful. Okay, thank you very much. I appreciate your time. Listen to my webinar. I think it's very good. Remember, lifestyle change and your weight control, everything has to work on it with diet, exercise, and your weight has to work on all these things we talk about today. It's so important. Without that, you will here and there, it goes up, your weight go down a little bit, but it will go back up. And you have to continue maintain the lifestyle change. And that's the way to go. I wish you all healthy. Have a wonderful weekend with your lifestyle change. And again, keep going. I think you can do it. So keep doing with the drinking LowSutea will help you become healthy. Take care. Thank you very much. Bye-bye.